This podcast is proudly brought to you by our partnership with Bayers for the Ask Maya chatbot service. Ask Maya is a friendly chatbot that provides information and options for family planning. So do check out the new tab in our Doctors app homepage for free counseling advice.
Hello everyone, welcome back to another episode of Doctors Podcast. In today's episode, we will be talking about nausea and vomiting in pregnancy. It's common to see contemporary TV shows portray women finding out about their pregnancies through sudden onset of nausea and vomiting. Indeed, nausea and vomiting is a common condition in pregnancy. Even though it's called morning sickness, it can occur anytime during the day. Nausea and vomiting of pregnancy usually starts before 9 weeks of pregnancy, i.e., first trimester. For most women, it goes away by 14 weeks of pregnancy. For some women, it lasts for several weeks or months. For a few women, it lasts throughout the pregnancy. Nausea and vomiting in pregnancy usually does not harm your health or your baby's health. It also does not mean that your fetus is sick. However, it may impact your daily activities. In today's episode, let's shed light on the mystery. Why do pregnant women feel nauseated and tend to vomit? The exact underlying causes of nausea and vomiting in pregnancy is still poorly understood. However, scientists have a few working theories. Number 1. Hormonal changes. Pregnancy-related hormones such as estrogen and progesterone relax smooth muscle and thus slow down the gastrointestinal transit time and may change gastric emptying. This can lead to nauseating feelings and vomiting. Another hormone called human chorionic gonadotropin, HCG, was detected at the highest level during the first trimester, the time when severe vomiting in pregnancy, known as Hyperemesis Gravitarium, is typically seen. Nonetheless, current scientific evidence show results that are inconsistent with this theory, suggesting that no single hormone during pregnancy can accurately predict nausea and vomiting. Number 2. Abnormal gastrointestinal motility. Gastrointestinal motility refers to the contraction and relaxation of the smooth muscles that make up the digestive system. Some pregnant women experience abnormal gastrointestinal motility and relaxation of lower esophageal sphincter, leading to gastrointestinal reflux. As such, they are more likely to feel nauseous during pregnancy. Number 3. Helicobacter pylori infection. Helicobacter pylori, or also known as H. pylori, is a type of bacteria that typically infects and lives in the digestive tract, particularly the stomach. Most women with H. pylori do not develop severe nausea and vomiting of pregnancy, but the infection may play a role in developing nausea and vomiting in some women. In a systematic review and meta-analysis of epidemiological studies, it was found that pregnant women with H. pylori infection are more likely to develop the severe form of nausea and vomiting known as Hyperemesis Gravitarium. Number 4. Other reasons. Other reasons that may cause nausea and vomiting in pregnancy include genetics, nutrient deficiencies, for example, zinc and vitamin B6, and also depression. Most of the time, nausea and vomiting in pregnancy resolve on its own or with the help of lifestyle changes and medications. One of the changes that help to relieve nausea and vomiting in pregnancy is dietary changes. For example, try eating before or as soon as you feel hungry to avoid an empty stomach. Eat snacks frequently and have multiple small meals that are high in protein or carbohydrates and low in fat. Try sticking to a bland diet. Drink cold, clear, and carbonated or sour fluid such as 100 Plus or lemonade, and drink these in small amounts between meals. Also, try smelling fresh lemon, mint, or orange, or using an oil diffuser with these scents. Consuming ginger containing food such as ginger lollipops or ginger ale can be helpful in managing mild nausea and vomiting. Triggers like odors, taste, flickering lights, or certain activities should be avoided to reduce nausea and vomiting in pregnancy. If lifestyle and dietary changes alone are not enough to manage nausea and vomiting, you may consult a healthcare professional for medical treatment. In general, medications that are commonly prescribed for nausea and vomiting in pregnancy are 1. Pyridoxine, or also known as vitamin B6. Technically, vitamin B6 is more of a supplement than a medication, but it can improve nausea and is safe with minimal side effects. The recommended dose of vitamin B6 is 10 to 25 mg orally every 6 to 8 hours. The maximum treatment dose suggested for pregnant women is 200 mg per day. 2. Antihistamines. Antihistamines such as diphenhydramine and cyclizine are also effective in improving nausea and vomiting in pregnancy. They are safe to be used during pregnancy and can be purchased from a pharmacy. Take note that antihistamines can cause drowsiness. Hence, they should not be taken prior to driving or operating machineries. 3. Dopamine Antagonists. These medications are usually reserved for more severe cases of nausea and vomiting and can only be purchased with doctor's prescription. They tend to have more side effects, and there's a lack of data about its safety in pregnancy, although they're still considered safe to be used. Some of the examples of dopamine antagonists are metoclopramide and domperidone. Vomiting can also cause you to lose body fluids. Taking oral rehydration salts can help to replenish the fluids and electrolytes that you've lost during vomiting. You can purchase them over the counter at any pharmacy. In rare cases, nausea and vomiting in pregnancy can be serious and even life-threatening. Hyperemesis Gravitarium is the term for the most severe form of nausea and vomiting of pregnancy, which can lead to loss of weight and body fluids. You should call your doctor if you have the following signs and symptoms of dehydration. You have small amount of urine that is dark in color. You are unable to urinate. You cannot keep down 500 ml of liquids per day. You are dizzy or faint when standing up. You have racing or pounding heartbeat. Sometimes, nausea and vomiting may arise from other causes besides pregnancy. Your doctor must suspect that you have one of these conditions if you have the signs or symptoms that usually do not occur with nausea and vomiting of pregnancy. Some of these signs and symptoms include nausea and vomiting that occurs for the first time after 9 weeks of pregnancy, abdominal pain or tenderness, fever, headache, enlarged thyroid gland, which is swelling in the front of the neck. It is not easy to be pregnant, let alone be a parent. Thanks, Mama! That's it for this week's episode. If you have any questions related to nausea and vomiting in pregnancy, you can consult our professional doctors and healthcare professionals on Doc2us. Doc2us is a mobile application that allows you to talk to a doctor or any healthcare professionals via text chat at any time and from anywhere. For better communication, you can even send our online doctor images or voice messages related to your medical inquiry. Download Doc2us app on Apple App Store, Google Play Store, and Huawei App Gallery. Or use our web chat at https://web.doc2us.com. Doc2us is not for medical emergencies. In the event of severe medical conditions, please call 999. Take care, and we'll talk to you next time. Disclaimer: as a service to our users and general public, Doc2us provides health education contents. Please note the date of last publication on all podcast episodes. No content in this podcast, regardless of date, should ever be used as a substitute for direct medical advice from your doctor or other qualified clinicians.